In the Sunshine State, it's always a good time to restock that sunscreen, but is yours safe? Joining us today is Dr. Andrew Weinstein, a dermatologist with Bethesda Hospital. Thanks so much for coming in. We certainly appreciate your time.
Thank you for having me.
There's a new study out about chemicals in sunscreen. Are those chemicals harmful?
Well, I don't think so. You know, it's important to know what you're putting on your body, and certainly the study that you referred to in the Journal of the American Medical Association concluded by saying the study is not a reason to not use sunscreen. So we know that sunscreens save lives. We know that people who use sunscreen, including chemical sunscreens, get fewer skin cancers, melanoma and non-melanoma skin cancers. And, you know, you can set your watch to it once an hour. Once every hour someone dies of melanoma.
Wow.
Yeah.
Oh, that is sobering. And speaking about those sunscreens with the chemicals, maybe for adults, what's your recommendation though for children? Is it still safe? Better safe than sorry, I guess?
Well, so yes, I think you should be safe, and chemical sunscreens have been proven to be safe in ages above 18 months. So,
okay.
You know, above 6 months rather. So what you should do is use the sunscreen that you're going to use. The sunscreen that's effective is the one that you use. So if there's something that's goopy that you don't like, you just need to move to the next sunscreen.
Keep finding something, yeah.
You know, babies have a lot of skin, for a lot of surface area for the volume of their body, so you do need to be careful with them. And the best thing to do is to keep them out of the sun, so you don't even have to worry about it.
There you go. You and I were talking during the commercial break about a lot of the cases you're seeing this time of year. You mentioned skin cancer. Are people in Florida really heeding the advice? You've got to wear sunscreen. It seems like we've heard that for years, really decades.
Well, there's an epidemic of sunscreen. I think, as you know, the sunscreen rates have doubled since 1985, and melanoma deaths are rising. I think people are heeding the warning, but they get concerned, and when there's reason for concern, the concern level is higher. But I think data so far is showing that sunscreens are both safe to our environment and safe for our patients. So if you're concerned about it, the best thing to do is stay in the shade when you can, wear sun protective clothing, and sunscreen where that's impractical.
And take us through, again, reapplying. That's also just as important. Mm-hmm. How often should we be doing that?
Well, the label says you should reapply every 80 minutes. So my opinion is once you towel off, you're not just drying off water, you're rubbing off sunscreen. So if you get out of the water and you towel off, you should reapply your sunscreen, certainly every 80 minutes. In the study that we were talking about before, people reapplied sunscreen 4 times during the day.
Oh, wow.
That doesn't apply to sun protective clothing though. So if you have a good sun protective shirt, you don't need to reapply.
And do you put your trust in that protective clothing? How do you feel about that?
So I do put my trust in that. The sun protection factor that's in clothing is good for about 30 washes. There are products that you can wash into your clothing that will reapply the sun protective factor. Get a new shirt if you think it's not working anymore.
Those lines are pretty popular here in Florida. Doctor, thank you so much.
My pleasure.